Now to the latest on coronavirus in Ohio. The state reporting just over 4,000 cases in the past 24 hours. But the Department of Health says that number is low due to an electronic lab reporting error. Meanwhile, nationwide, the U.S. has now passed 72 million cases of COVID. Cases are beginning to decline, but still remain higher than in other surges. And while we continue to fight the Omicron variant, and we've been warned of more variants to come, there's word tonight about another viral spinoff of Omicron. And early reports show it could be more contagious. But doctors say it's too early to panic. Our Laura Queso has more.
The World Health Organization is keeping an eye on a new subvariant of Omicron because it is now spreading to many countries across the globe. Cases have been reported in California and Washington. So far, none reported in Ohio, according to infectious disease specialist at Rainbow Babies and Children's Hospital, Dr. Claudia Hoyen.
Two different variants split off. One is BA.1, which is the one that's around the world right now. Here in Cleveland, it is probably about 99% of all of the Omicron that we're seeing.
And then there's the sister variant, BA.2, and it's circulating quickly.
It sounds like it was first identified somewhere in Asia, probably the Philippines.
Dr. Hoyen says it now makes up about 50% of cases in Denmark.
Some people are referring to it as being stealth.
That's because it could go undetected on a PCR test.
It may be more contagious than Omicron BA.1, but I think it's very early in terms of how worried do we need to be about this.
But Dr. Hoyen says it does not seem to be causing any more severe disease than Omicron BA.1, the one we're dealing with right now. Meantime, Pfizer is launching a new clinical trial for a vaccine specifically targeting the Omicron variant.
By the time this clinical trial is completed, Omicron may not be an important variant. But if it is an important variant, then we'll have a new vaccine that's more specific to Omicron.
I don't think it's going to be the last variant that we see.